Thank you, Senator Anwar, and hello, everyone. I'm struck by the fact that of all the people in this room, I definitely know the least about livers, and I am grateful for the opportunity to be here. I especially want to thank Drs. Vahey and Bonini for inviting us here today and the commitment that you have made to advancing liver health here in Connecticut. We have all benefited from their leadership, both on the Public Health Legislative Working Group, also creating the event today, and their life-saving work as physicians and researchers and educators. So today, part of what we're here to talk about is the legislative strategies to improve liver health. And I come to that conversation, as I said, as someone not schooled in the way that all of you are, but as a policymaker, a member of the working group where I had the chance to learn from those great physicians, and as a layperson. So first, as a policymaker and leader with Senator Anwar of the Public Health Committee, the statute creating the working group really came as a result of Senator Anwar's passion and understanding about the issue. And Senator Anwar and Dr. Vahey have had a chance to work together in the past. And why? In the hundreds of bills that we were asked to consider, did we take a look at this and advance this one? It's because too many people don't know the impact of MASLD and MASH. We are citizen legislators. Only 2 senators in the General Assembly are MDs. We have a handful of nurses, but most of us are not medical professionals. And we are your representatives. So I'm here today to encourage you to talk to all of us, to get to know how to reach your representative and who they are, and ask simply to build a relationship if you have a specific ask, but also to create that relationship so that when the time comes that you are advocating and asking for something specific, you will have that. I often joke that it's great to know your legislator's love language, how it's best to reach your legislator, just like as physicians, you tell your patients the best way to reach out to you. I know some people hate the email messaging now, and some people love it, for example. Translating. At the committee, I often talk about talking to us as legislators at the 4th grade level. I know that Senator Anwar is far from the 4th grade level, but I say, as a layperson, we need to hear things at that level, in part because we're hearing such a wide variety of issues, and make the case for why this deserves attention, the attention that it does. My eyes were certainly opened when I learned that 30 to 40% of Connecticut residents are dealing with MASLD. I was shocked as the co-chair of the Public Health Committee, to give you a sense. Second, I'm here because I was a member of the working group, and I really, again, cannot thank our 2 physician leaders for the work that they did. Our professor co-chairs know that I didn't have perfect attendance, but I managed to learn quite a bit, though not necessarily how to pronounce all the words that fall so easily off your tongues. But what I did learn is the way that MASLD and MASH progress silently, and that the greatest increase is among 18 to 39-year-olds, and that our Hispanic family members, friends, and neighbors are more susceptible, and this was shocking news to me, and helps us all understand that we have to do more. I heard the familiar refrains about less sugar, less fructose, less carbohydrates, more exercise. But I didn't understand. I know the impact on heart disease. I've heard that for years. But I did not understand the impact on my liver. I love how you describe the liver, Senator Anwar. I'm going to use that going forward. In the end, the group had 20 different recommendations you may have seen. I'll just simply go through a couple of them. Getting the word out through the state media, school nurses, healthcare providers, health systems, and more. Screening, using electronic medical records to identify people who are high risk, using transient elastography. Am I saying that right? Yes, nods. In high-risk areas, especially places where there are food deserts, leveraging existing processes, including the state health dashboard, the state health improvement plan, and hospital needs assessments, identifying funding partners to seek coverage and mitigate costs, and highlighting the specific risks of fructose. What was clear by the end was something that Dr. Bonini said at the very beginning in her remarks, is that we are going to have to work across systems and even in the legislature across committees to advance these recommendations. Leadership, time, and funding will be required. It will mean aligning more with leaders like Dr. Mahal and Dr. Benini and the American Liver Foundation, Yale, and so many other partners. Finally, I'm here as a layperson, as I said. Though I'm a social worker, I come to this conversation really as a mom, a neighbor, a friend to people in the community. And last night as I was preparing remarks, I was sitting at my kitchen table with my husband and a neighbor who were having dinner and a cocktail. And I was showing them the American Liver Foundation graphics included in the working group's final report. And we all had a good laugh about the helping hands portion guide graphic that's in the report. One thumb is a portion of cheese. I was appalled. That sounds just awful. Just one thumb of cheese? This is what you all are doing, and it's not a laughing matter to you as you deal with these very serious issues. We were looking at the BMI index, the chart, and one of the two sitting at the table, I won't say which one, whether it was my husband or my neighbor, was actually officially categorized as overweight. These are two gentlemen who ride thousands of miles on their bicycles every year. If one of them are categorized as overweight, I don't think most people recognize that. And I know we're not here to talk about alcohol, but obviously with the liver, how many people are surprised to learn that for women, 4 drinks, and for men, 5 drinks in one occasion is considered binge drinking. And I know we don't like to have that term applied to our Super Bowl parties and our backyard barbecues, but it's part of what we have to let people know. So how do you break through the noise and the overwhelm? Doesn't everyone already know that too much sugar and too many sodas and not enough exercise are no good? How do you get patients to pay attention to portion sizes when people are arguing over whether we have a food pyramid or my plate and who's right about nutrition advice? How can you help people to believe all of you rather than online influencers who are making a lot of money on supplements and magic solutions? So we need you to continue to be translators and to help us all, the lay people and policymakers, understand why these issues are so important to the health of our livers. I hate to say this because I'm not doing this well enough myself, but we are probably going to need more of you to become your own content creators on social media, to meet people where they are, or to encourage the system that you work within to do the same. Because we find that people are trusting large institutions like government, like large medical institutions less, but they continue to trust their providers. We may need you to talk to artists and cultural influencers. The Connecticut by the Numbers just had a piece about musicians and other cultural leaders and their role in influencing public health. And you have to do all this while you're trying to treat and help the people who need you to help heal them and help them to survive. It's a tall order. And I'll also add the connection to the social determinants, the role of the built environment, the role of housing, all of those things. As daunting as this is, we are here to say that you're not doing this alone, and we are proud to stand alongside you. I want to thank Senator Anwar for his leadership in bringing this forward to the committee, and Dr. Mahal and Dr. Benini, you have successfully launched us into the next steps on this journey, and I'm grateful to be here for it. Thank you.